Hello viewers. So today we are back with another topic, and today's topic is intracerebral hemorrhage, which is also known as brain hemorrhage. And today we are going to discuss mainly how we can prevent it. As you may have some idea that brain hemorrhage is a catastrophic disease where one of the blood vessels in the brain ruptures and the blood leaks out in the brain, and that can result in severe headache, vomiting, paralysis of hands and legs, loss of speech, and in very severe cases the patients can become comatose, and it can result in death of almost 30 to 40% of people even with the best of treatment. And as you can understand, there is no medicine to treat brain hemorrhage. Only thing available today is surgery. And if the hemorrhage is in some area where a surgeon cannot reach easily, then surgery also is not feasible in many cases. And so as you can understand now, is that preventing brain hemorrhage is the best option, or I would say rather the only option we have. So I would discuss 10 strategies which can be employed on a daily basis or in our daily lives, which has the potential to prevent most cases of brain hemorrhage. So if you look at the number one risk factor for brain hemorrhage, it is high blood pressure, also called as hypertension. As the blood pressure increases, the risk of brain hemorrhage also increases. So one has to find out whether BP is normal or not, and the only method is to check the blood pressure. So keep checking your blood pressure regularly. There is no symptom of high blood pressure. So the first time many people get to know that they have high BP is after they have suffered the brain hemorrhage. So when they come to our emergency and we check their blood pressure, it is very high, like 200 systolic or sometimes 220 or even higher. And till they got the brain hemorrhage, they had no other symptoms of high BP. So the only way to check is know that whether somebody has high BP or not, is to measure the blood pressure, and it should be kept below 120 by 80. If the blood pressure is high, then consult your physician. Try non-drug measures like reducing weight, doing exercise, and if that don't work, then the physician may advise you medicines to lower the blood pressure and keep it normal. The second method to prevent is, many people are on medications which are known as blood thinners. So in that you may have heard of drugs like aspirin, clopidogrel. Some people also take warfarin and acetylcholine, and now we have newer anticoagulants. So these are the medicines given to people who have suffered heart attack or brain stroke in the past, and they need to take these medicines almost lifelong to prevent the second or the next episode of heart attack or stroke. But these medicines also have a downside, that a small number of people who are on these medications, they can suffer from bleeding complications, and that bleeding site can also be inside the brain. So normally for warfarin and acetylcholine, the doctor will ask you to do one blood test called as PGINR, and that helps the doctor to decide the correct dose. So please keep doing it as per the doctor's advice, and so that the correct dose of these medicines can be given. And sometimes you may have the person who's taking these medicines may have subtle signs of bleeding, like it may be bleeding from the nose, or mild gum bleeding while brushing the teeth, or sometimes blood in the urine, or blood while passing stool, or sometimes the reddish or the purplish patches under the skin, what we call purpura. So these are signs of minor bleeding, and one has to consult the doctor when these minor bleeding happens, so that the medicine dose can be reduced or stopped for a few days, or the cause of this bleeding can be identified, so that we can prevent severe complications like brain hemorrhage. And then coming to the third is the accidents, the brain injury, head injury, which happens on the roads. So, and the commonest cause is people not wearing helmets on the two-wheelers or not wearing seat belts in the four-wheelers. So definitely, these are protection. These protect your body, your life, and the most important, your brain. So whenever you are out on the roads, please wear helmets and seat belts also. Then the next fourth and point are the habits which are linked to brain hemorrhage, and as you may have guessed, these are the two: alcohol and smoking. So alcohol is known to increase the risk of brain hemorrhage. There are two methods. One is that sometimes there is something called as binge drinking. So people consume lot of alcohol on one day, and this called episodic binge drinking. Binge drinking can increase the risk of brain hemorrhage. And also those who drink on a regular basis for longer time, either alcohol directly can cause brain hemorrhage, or it leads to liver disease, chronic liver disease, which can cause coagulopathy and bleeding disorders, and then that can result into bleeding complications in the brain or brain hemorrhage. Second is the habit is the smoking. Again, smoking or the use of nicotine is linked to high risk of causing brain hemorrhage. So one has to abstain from alcohol consumption and quit the smoking. So these covers the first 5 risk factors, and then we look at some of our daily lifestyle activities. So one is what kind of foods can be healthy. So definitely consumption of fresh fruits and vegetables, they are healthy and they reduce the risk of brain hemorrhage. Whereas people who have high blood pressure, uncontrolled kind of high blood pressure, they should avoid having coffee, because studies have shown that consumption of coffee in a person who has very high blood pressure or difficult to control blood pressure can cause acute rise in the blood pressure and can result into brain hemorrhage also. But those whose BPs are well controlled, or those who do not have high blood pressure, they can safely consume coffee without the fear of getting brain hemorrhage. And then 2 things regarding our sleep habits. So we know that both lesser sleep duration, that is less than 5 hours, or oversleeping, which is defined as more than 9 hours, or in one study more than 8 hours. So participants who overslept more than 9 hours or those who underslept less than 5 hours, both groups had a higher risk of getting brain hemorrhage. And one more disorder of sleep called as OSA, or obstructive sleep apnea. So this sleep disorder also is linked with snoring and increased risk of hypertension, that is high blood pressure, and brain hemorrhage. So if somebody has snoring, get evaluated. If you have OSA, then use the treatments advised by the physician to reduce the risk of brain hemorrhage. And those who are not sleeping adequately, or those who are oversleeping, sleep for 7 to 8 hours at nights on regular basis to reduce the risk of brain hemorrhage. And then if you look at the last 2 factors, so they are linked to our daily lives. One is the stress. So we know that anyone who has high amounts of stress can again result in increased blood pressure and increased risk of brain hemorrhage. And the last point is related to our jobs. So what is known as those who overwork. So the recommended duration of work is 8 hours of work per day for maybe 5 to 6 days in a week. So those who work for 8 to 12 hours, they have a higher risk of getting brain hemorrhage as compared to those who work less than 8 hours. And those who work for 13 hours or more, they have an even higher risk. So one has to minimize the duration of work and keep it to reasonable levels of say 8 to 9 hours in a day and not more than that. And the last point is the amount of strenuous activity. So those who do 8 hours or more than that of physically strenuous work can also result in higher risk of brain hemorrhage. And there are some things which are correlated, like if somebody has done vigorous exercise, then again we have seen that the risk of brain hemorrhage may be higher. So this brings to the end of our discussion. And what we have discussed today, just to briefly summarize, the 10 points are: first is check BP, keep BP under control. Second is if you are on blood thinners, then look for signs of subtle bleeding, do the appropriate blood test as recommended by the doctors. While driving, use helmets and seat belts. Avoid alcohol. Number 4, avoid smoking. Number 5. Number 6 is consume lots of fruits and vegetables. And then those who have high BP should avoid coffee. And then in the sleep, OSA should be diagnosed and treated. Sleep adequately of say 7 to 8 hours every night. 9th point is minimize the stress, keep it under control. And last point is have reasonable amount of working hours of say 8 to 9 hours per day, and avoid doing too much of strenuous physical activity during the work. I hope you learned something new today, and you please like this video, share it, and post your comments or queries, and then I'll be happy to answer them. And subscribe to my channel for more similar educative videos. Thank you.